Hello, welcome to nobody yet, but that's okay. We're doing this just for fun.
Yep.
All right, it looks like we've got people popping in. We'll wait just a second. Thank you guys for joining us. It's 5:30 on a Tuesday. It's beautiful outside. There's just a tiny little pandemic happening, but otherwise the world is still good. So we are here again today. I'm Jen Bacani McKinney.
Destiny Wheeler.
And I'm your county health officer for Wilson County, and Destiny's your health department administrator. And we are super excited to be here and to answer your questions. So go ahead and start heckling us or putting in questions. We will take all of them. We have to start off, though. It's only right to start off by sharing our t-shirts made by Shelby Smith.
Yes.
Okay, go for it.
Okay.
Look at this.
Check these out. A contact of a contact is not a contact.
And when in doubt, camp out, meaning quarantine. Thanks, Shelby.
Thank
These
you,
are
Shelby.
amazing. So, and we can explain that more later. And now you can also see we are wearing shirts and pants today. So we've already covered that for today. Congratulations to us. So I think what we're going to start out with is the great news of the count of how many positive cases there are in Wilson County.
None.
Yay!
There are no positive cases in Wilson County.
We know you're all cheering at home. We can hear it. Our hearing is good.
We've had 25 negative tests to date, so that's doing good. We did want to update you on the numbers for Kansas. So far in Kansas, there are 428 cases with 9 deaths, and those cover 39 counties. Those cases, not the deaths, obviously, but the cases. And there have been almost 5,000 negative tests in Kansas. So we are seeing the numbers go up, but we're testing a lot of people and we're reaching a lot of people. So we wanted to point that out because, yeah, Kansas
a lot
is
of
doing a good
people
job.
wonder, are we doing enough testing? And we're doing as much testing as we can. We still know that the resources are low throughout the country and parts of the world, and so we appear backwards.
Sorry.
So we're not just testing everybody, but we are doing a lot of testing, and we're seeing the numbers that we would expect. So.
Yes. We have 3 days a week, we have a conference call, or Dr. Norman, I guess, Dr. Lee Norman has an update 3 days a week. And yesterday he said that they are actually getting some new equipment in at the state, so they'll actually have a higher capacity to be able to do more tests and do them more quickly. So that'll be really nice. Right now, we're seeing a much quicker turnaround in tests than we were even a week ago.
Yeah.
So things are moving along.
And we're getting them back in about 24 to 48 hours, pretty much with every test, whereas it was taking a week.
Up to a week, yeah.
So we're very happy about that.
Yeah.
Do you want to talk about the peak?
Oh, yeah. So a couple weeks ago, KDHE's epidemiologists, they predicted that by the end of March, we would have between 300 and 400 cases, which we can see. It was pretty accurate. We're at 428. So that was a really smart guess.
Better guess than me.
Yeah.
But I think I want to take that epidemiologist to Vegas, is all I'm saying.
Yeah.
Or maybe buy lottery tickets with them.
Yes. Yeah, because they're pretty smart. We're seeing our numbers in Kansas right around kind of the average. They're about 18% hospitalization, which is about right in there where everybody else is, and right at 2% death rate. So those are for deaths against people that were tested positive. So some of those people, some people aren't getting tested, and we're not capturing all of those numbers, but these are right on target with the numbers for what they were expecting. So Dr. Norman's super smart epidemiologists are now predicting the peak of the COVID-19 activity in Kansas to be on or around April 24th. Yes. So we're kind of in it for the long haul, but
But
Yeah.
at least we have a better idea now.
Yeah.
The trajectory of how things are going. So we will see if, Dr. Norman, if he is close, we also will try to get him a job at Worlds of Fun where he guesses people's weights and birth month. Because, man, that was my favorite thing back in the day. So we'll see how that goes. Alrighty, we do have some questions. Do you have tests to give? We have plenty of tests right now. As far as our surrounding areas, I don't know exactly how many tests they have available. So, but we are working regionally so that if our neighbors are needing help, we are all about trying to figure out how to help everybody. So, there was another question in here somewhere. Let's see. I think I might have missed it, but we will look. We are going to have some serious talk for just a bit. Grab your drink. Water. Stay hydrated. Water. So we're going to talk a little bit about what it means to be in a stay-home mandate. So that's brand new, right, as of Saturday. So since the last time we talked, and we're kind of good at predicting, right? We said Friday that we thought that was going to happen soon, and it did. So what that means for us is that it comes in multiple parts, right? So a lot of people think, we'll keep social distancing. That's what it means. It actually means that we want to practice social distancing, we want to limit our non-essential travel, and we also want to adhere to the rules of not having more than 10 people in one setting. So that doesn't mean that we can all just like congregate like far away with the 6-foot rule. It doesn't mean that we're just going all over the place or going to other counties or even within our own city or county just to go. It does mean that we have to be responsible and we have to use our common sense. So Destiny and I have talked with the city governments, we've talked with the county, of course, and just tried to figure out what it means to be what it means to have essential travel. If you're an essential business, or if you have an essential job, the state officially makes that call, and so we try to give guidelines for that. But when in doubt, we're going to contact the state and try to figure that out. But we want to try to help guide us through this because it's not easy for anyone. We don't want anyone to have to be at home and not be able to earn money. We want to be able to help and interpret those rules. So as we are calling businesses and saying, hey, what are you doing to try to limit people in your business all at one time? Or as we're saying, hey, we probably shouldn't do, this caravan or this cruise route, and again, that's us. You can blame us for having those conversations, but in the end, please blame the virus because it's way more of a jerk than we are. Mm-hmm. So we just want to do the right thing for our community. And what we do know is that we don't have to just sit idly by and let things happen to us. We know that we can actually control some things, and we have some power in everything that's happening right now. And so we want to be able to do what we can do. And the only thing that we know that we can do, as proven by other states and other countries, is to be able to stay away from each other, practice social distancing, keep the gatherings small, also limit non-essential travel. So when we feel like that's something that's restricting us or taking away our rights or our freedom or the things that we want to do, in fact, it's actually the only thing that's giving us our power and our control over what actually is happening right now. So please remember that these things are important. We're not just doing it to be fun suckers. We can be fun suckers all the time. Yeah. But right now, we're trying to be non-pandemic fun suckers. Yeah. Wait, pandemic non-fun suckers. Yes. I think that's a big difference between those two things. But we're just trying to keep everybody safe and healthy. So please don't get mad at us as we're having these conversations. And that's all we're doing is having conversations. We're not going around and laying down the law. We're just talking and getting clarifications on what people are doing and helping to assist in ways that we can help you and your business or your company or your family continue to stay healthy and do well. All right, coffee talk is over.
Yeah, kind of.
Okay, keep going.
Okay, so there are some specifics, and there are some there are some exemptions from the governor's order. One of the exemptions are church services. You are allowed to have church services. You are allowed to have funerals. You are allowed to do weddings, things like that. But We are recommending that you do them online or record them and take them to people and really limit those gatherings, because there was a kind of a ministerial conference, I guess, in Kansas City, and we have seen a lot of cases come out of that. It's not, we're recommending against all conferences too, but we're seeing church choirs passing this around. We're seeing things like that, and we're not picking on churches. We really want to keep these numbers small. We just want to point out that we would really, really like you guys to limit your numbers, to keep your social distancing, be ever vigilant.
Oh, you know
be
what?
vigilant.
We're making up words, because they can't correct us right now.
Yeah.
Please don't correct us.
So be super vigilant about your 6 foot spacing, and just really try and be responsible.
And I want to point out that my cousin Carrie Pattison here saying ministers are the worst. She actually is one, so she's not. She's not being terrible. Thanks, Carrie. Really funny. I love it.
Yeah. And another very specific thing that the governor says, it talks about bars and restaurants. Bars and restaurants should not be having people come in and dine. Period.
Not at all. Zero.
Yeah, period.
So if
that
you're thinking
should not
about
be
it,
happening.
don't do it.
Curbside delivery, to-goes are okay. Delivery is okay. Not for bars. You can't deliver mixed drinks.
Okay, I just want to clarify. Not delivering mixed drinks.
Not delivering mixed drinks. You can deliver food all you want.
Yep.
But same rules apply with alcohol consumption as they did before. So if you're concerned about a restaurant or a bar, you can call the health department. We've made a couple calls already just because people weren't sure. So that's the bottom line there.
Dr. Nunemaker in Wichita says, please, for the love of God, which I think you can say if you're talking about church, don't attend church with others in close contact. I mean, again, thank you, Doug, for your recommendation there. What we really want to do is we want you to practice all your beliefs and we need prayers right now, right? Anyway, so please keep doing it, but from a reasonable distance away from each other.
Yeah. And Lori, so of the 3 methods that are allowed, delivery, carry-out, and curbside, carry-out is the least preferred. We would prefer people just stay in their car. That way that food service worker can, wash their hands, make your food, take their clean hands and bring you your food, and then go wash their hands again. When you're going in and you're touching the counter that everyone else has been touching and sneezing on, and then you're getting in your car and you're touching your steering wheel, you're touching everything, maybe your face, and you can't wash your hands until you can go home. So that's the most preferred way, is one person touching the food, bringing it to you.
Yes. So again, we know, and we are addressing things. We know as things move forward. Again, we'll be having those conversations, but we are aware that there are places that are still kind of trying to stay open or have people in the restaurant or bar. So we're working on that, but please do our part by staying out of those places. We want to support everybody the best we can, but we have to do it in a safe way. Really interesting stuff today. Stop Touching Me, that's from Dr. Price in New York. Turns out, Dr. Price, no one wants to touch you, not even your wife. She's on here as well, and she, I think, commented on that. So cool. Let's see. And yes, Carrie, definitely it was a joke. She's a minister, and ministers can joke about ministers. I think that's a thing.
I think that's a thing, yeah.
And she said that vigilant is a word because it's diligent and vigilant.
There you go.
Again, said by a minister. It's like medical fact.
Yeah.
Right?
Yeah.
I will stamp it as well. All right. How about, offers to deliver mixed drinks. Thank you. Are there supplements or vitamins that can be of benefit? What we usually say is just be as healthy as possible. Get good sleep, 8 hours at night if you can. Drink lots of water and stay hydrated. Eat a reasonable diet, fruits and vegetables and all that. And if you do all that, you'll give yourself the best chances that you can. Exercise, it's beautiful weather, so do what you can. But in general, for supplements and vitamins, not really anything in particular. What was that?
Viagra.
Oh, Viagra. That is not a supplement at this point, I think. Alrighty. Let's see. How about Dollar General was full of children with no parents in sight this afternoon? Okay. Again, our kids don't really get it. They just know they aren't able to play with their friends right now. And so please, let's tell the parents, let's tell each other, let's not be afraid to say that we are, we need to keep the kids out of Dollar General. It's a thing where we all have to help each other, and we hopefully will receive that advice very friendly way.
Yeah, personally, my kids feel very attacked by this. They want to go to the store, and they want to go to the convenience store and try the new yogurt dipped Skittles.
Oh, that sounds disgusting.
It does sound disgusting. But they want to do that, and they're mad at me because I keep telling them, nope, you don't have to go. Nope, you don't have to go. And so just parents have to be the bad guys sometimes for the betterment of the kids.
And of the community and of the world at this point, right?
Yeah.
So we're all in this together, and that's kind of the message we want to share with everybody. Have you had people come in that you believe have it but don't meet the testing criteria? Right now, we'll tell you that we are able to test people that don't meet the state testing criteria. If we have a high suspicion, we're going to be testing them. So we're doing our best to keep everybody safe and catch all the ones that we can catch.
Yeah.
We'll tell you, we also are still seeing influenza. We're seeing some crazy other stuff, other respiratory viruses and everything. So don't be surprised if you feel like you might have a really severe disease, but there's just a lot of stuff. Allergies are terrible right now. It's just kind of not fair right now, I think, and it's tornado season.
Yeah, but I will assure you that your doctors are all working together. Your providers, all of the providers in the county are working together. They are bouncing ideas off of each other. I'm getting calls every day. I'm sure Jen's getting calls every day.
Oh, yes.
We are on our phones all the time because it's like, hey, this person came in. What do you think? On the safe side, test them, don't test them. And usually we're opting for the safe side at this point when we can.
Yeah. And I do appreciate there's some comments in here. It looks like Robert has been social distancing for 20 years. Thank you for paving the way for the rest of us.
Thank you, Robert.
We also see that people are gaining what we call the COVID-19. It's like the freshman 15. We're sorry, that's a thing that's happening, so be outside and exercise. And there was a question about churches and can we consider like a drive-in service where the sermon is broadcast over the radio and participants stay in their vehicle with their family, and there's several churches considering this. It's a great question.
It is a great question consider it. Yeah. If people are staying in their cars, I don't know, it makes
Within
me
their
think of like the
families.
cruises.
So
a little.
As long as if they're staying in their cars, you're going to and from church only, we would consider that. I mean, I believe that would be something we consider okay. Again, let's kind of figure out what that looks like, because then if it's everybody getting out of their cars but trying to stay 6 feet away, some of these are things that we've heard about. That's not the same. But if we're staying in the cars and within our family units, that may be reasonable.
Yeah, and if it's on the radio, you could stay home and watch it.
Oh, that's true. Yeah.
Listen
that
to
is
it.
True. Yeah. Maybe try that instead if it's on. And like Facebook Live is even better. Then you can see everybody. And or not everybody. The priest or pastor or whatever everybody else has. We're seeing flattening of the curve because Kansas. Okay, Dr. Nunemaker pointed out that Dr. Tom Moore, who's one of our great infectious disease doctors out in Wichita, he said earlier today we're seeing, fingers crossed, flattening of the curve because Kansans are working together to keep people safe and healthy. Please, everyone, continue to help your fellow people. And that's true. I think that Kansas, people might say, well, we don't have a lot of cases, or in Wilson County we don't have any cases. But what we are trying to do is we're trying to be proactive. We don't want to wait until there's cases, or we don't want to wait until there's community spread, because at that point it's too late. So I believe that we're doing the right thing right now.
Yeah, and whoever asked about jazzercise, us teaching jazzercise, I
that
can
Toby?
promise you that
No.
it would not
We're very
work.
uncoordinated.
We are super
I mean,
uncoordinated.
look at us. You can tell. Like,
Yeah.
just look at us.
I can't even
I'm a
say a
mathlete.
word straight. I mix it up. So, yeah, no.
And yes, I passed along to my children mathletics, and that's it.
Yeah.
Nothing more.
Yeah.
And I'm not even good at that. Poor kids. Sorry, kids. So another question I believe is, are we cooler than the Tiger King? Yes, actually.
Yeah.
Thank you for asking. I mean, people have wondered that a lot. We often are compared to Tiger King. So check it out.
I've never even watched Tiger
I
King.
know. If you're going to do a thing, apparently that's the thing to watch these days. So let's see what else we have. We have lots of great people watching. Drive-through communion. I don't know. That's where we're getting real close, and we have to really, that would be something we may not encourage because there's a potential for that droplet contact.
Yeah. Yeah.
And
I would not.
What are you telling people who ask about wearing masks in public with changing information out of the CDC? Great question for once in your life, Dr. Price. Poor guy. I haven't been able to heckle you on your own Facebook Live, so this is it. So it is a great question because the CDC is talking about should everybody in public be wearing masks, and so whereas we were saying don't wear masks, it's not the right thing to do, we're relaxing that at this point, and we're saying, do you have any exposure risk? Do you have any? Are you a high risk patient? I don't know. Do you need to be wearing a mask for any reason? And we like to talk that out with our patients and with our community. So we're just continuing that conversation. We don't know the right answer, and I don't know that anybody does, but we're just trying to learn as much as we can from again, the other countries that are kind of ahead of us in the timeline, or other states. So maybe Mike in Ohio and Mark in New York, if you guys could just test it out on your patients and in your states and let us know how it goes, and then we'll figure it out in Kansas. Oh, he enjoys heckling. I love it. Okay.
Diane, I saw your question about outdoor activity and going out of county to go fishing and things. One thing that has come up a lot in the calls with KDHE, and I know Kansas Department of Emergency Management is kind of addressing those outdoor activities across state and county lines as well, like hunting and fishing. And so this is my opinion. Outdoor activity and exercise are two different things. Mm-hmm. And so if you're going outside to exercise, walk, whatever, you're generally in your home area. It's okay to go to a nature trail. It's okay to go fishing. Just be really aware of where you are, who's around you, your distance from everyone.
Because we're not far away from other counties that have cases and more than one case. So we need to start just keeping track of that each day and making sure that we're aware of what we're doing.
Yeah, it's great to get outside. It's great to be out in the sun. It's great to go fishing. We have been fishing a lot, but we've been fishing at our pond. So we've not been, going out a lot. But the kids have. It's been great just for us to get outside and not be stuck in four walls anymore. So we would encourage that. Just really be careful.
Right. And Blaine, thank you for this great question. If it's supposed to peak on April 24th, would we anticipate a stay-at-home order longer than April 19th? Probably.
Yes. And that's gut feeling there. They've not said that, but they did say that they could extend it at any time. So, do you want to talk about why they made it as long as they did?
Sure.
Because, they haven't said this at the state, but this is my own interpretation.
This is coming from who we like to call Destiny or
Destifer.
Destifer.
Yeah.
Yes.
Yeah. This is Destifer's interpretation of why the stay-at-home order is going to last 20 days.
It's like Brangelina, just in case you weren't sure. And thank you to my sister for coming up with that.
Yeah. So the incubation period on this virus is 2 to 14 days. I know we've been saying that for weeks and weeks, but most anyone who's going to develop symptoms does it in the middle of that 14-day period. So if you have a stay-at-home order for nearly 3 weeks, then you have time for the people that are already infected to go ahead and get sick, and their contacts to go ahead and get sick. So that's why it's as long as it is, in my opinion. And I could be wrong. Any of the docs on here can jump in and say that I'm
They're not shy.
full of beans. But that way we are not going out spreading it more. With the people that are going to get sick are going to get sick while they're at home. That's my opinion.
Spread love, not coronavirus.
That's right.
I think, is that our... We have many shirts coming up. Someone asked what our shirt said. Let's show them one more time.
Oh,
When in doubt, camp out.
And contact of a contact
Is not a
is
contact.
not a contact. I couldn't.
Okay, we have a couple other questions. Now, Mike points out, and Mike's a doc in Ohio, a family doc in Ohio. Thank you, Mike, for being here with us every session. It's so great. He's seeing more homemade masks this week versus last week, and we've addressed that at each of these sessions because it's a great question. Is it helpful to wear a homemade mask versus nothing at all? What we're saying is if that is our last resort, we as healthcare providers would do that. But if it's really our last resort, in general,
With a face shield.
Yeah, with a face shield and other protection too. In general, what we fear about saying, yeah, get your your mask made by your grandma or whatever. I don't know who's making these days.
There's a lot of people making masks because a lot of people want to help.
Yeah. So, and it's super nice for people to do it, and don't stop. I mean, it's okay. But we also don't want people to get a false sense of security wearing those masks and say like, oh, okay, well, I can go out and do whatever. Because depending on the material, depending on what you're doing, and if you have symptoms or not, it's hard to say if they are fully protective. So be very cautious about
and masks are not comfortable. If you've not worn a mask, it is not comfortable, and they slip and they wiggle, and you're constantly wanting to reach up to your face and pull them up and tighten them up and adjust them around your mouth, and that's where you don't want your hands, is in your face.
I don't know how people have beards, right? Like, I feel like anything on the facial areas.
Well, it grows there.
Well, I know, but I just feel like it would still be like, I'm just saying, we'll
I
discuss that
couldn't do
next
it.
time. Beards. When we grow our beards and stashes out, we'll let you know. Lori, thank you for asking. You asked if it's beneficial to take your temperature at home twice a day or just stay on top of your own symptoms. Anytime you're monitoring yourself, there's not really a particular amount that you should check your temperature, but like in healthcare, we're checking our temperatures daily and just making sure, because we might have a temperature that's creeping up without having any other symptoms. So that's part of the monitoring, would be checking your temperature if you have any reason to think that you might have symptoms or might have been exposed. Mark.
Oh, I can't see it good enough, so it's taking me forever to read all of them.
Mark, Dr. Price again in New York, shares with us that he's currently taking his rectal temperature. Just kidding. He was just looking for his head. Yeah! Thank you. High five, long distance, everyone across the world. No, it's not any better, thanks. Scott Pierce, the creator of our Tiger King pictures today. Do you professionals know anything about tigers? No, but we're working on that next. It is not spread to tigers as far as we know.
Not as far as we know.
Not as far as we know, but we don't really know. There was a question about the Burlington nursing home. I read some. Do you want to address that, or? It is true that there is a nursing home here in Kansas, in Burlington, where they have multiple residents who have coronavirus, who are symptomatic, who tested positive, and also some of the healthcare workers there. I believe that the numbers are accurate that they've released. That was the question, is if the numbers are accurate there. So
according to KDHE, Coffee County, which is where Burlington is, has 14 cases. So that would make officially sense. The only thing that we know. Officially from KDHE, because they're who we use for our data. So 14 is the number of cases there, and they are the same nursing home.
Like
brand.
ownership.
What is it?
Like the
franchise.
Let's go with franchise.
Franchise.
Franchism.
As they have been in a couple other outbreaks, but they are saying that that's just coincidental because they have a lot of homes around the nation. So the odds of them having more outbreaks is higher because there are more of them. They've studied their protocols and they haven't seen any specific reason to say that they're negligent.
Right.
And I just want to shout out to our local long-term care facilities. They're doing a fantastic job of keeping their residents safe so far. So
and keeping them, happy and
the pictures are great and
it's super cute.
Yeah, they're doing good things.
Here's a great question about if there would be a case in Fredonia or Wilson County, would the stay-at-home order be up to a lockdown, or how would that all work? So I don't believe at any point, we're not seeing like lockdowns necessarily.
No.
House arrest, was one thing that Governor Kelly said, this is not a house arrest, when she was announcing this. So we're still going to encourage people to, I don't think there's a point when we're not going to encourage people to be outside, to exercise, we'll still need people doing the essential functions. So I don't believe that would be the case. Would you agree?
Absolutely, yeah.
All right, awesome. Okay, what other questions are we missing? Because I know we sometimes get a whole bunch at once. Dr. Price out in New York, he has a Facebook Live tomorrow on Family Medicine of Malta on their Facebook site at 12:30 Eastern, which is 11:30 Central, which I found out after I missed the first two. I'm not good with time zones. I'm just good at medicine. I'm a doctor, only a doctor. Let's see. What else? Outdoor activities. Is there anything else that we missed? And again, we appreciate everybody that's listening and that's asking questions. We get a lot of questions in between. We did get a question about Easter visitors. That was something else. Yeah. You want to go for it? It's a hard answer.
It is a hard answer because we don't want to be fun sponges.
No, that's like fun suckers is different than sponges because we're soaking the fun up ourselves.
No, my kids.
Really?
My kids call me a fun sponge
Please
all the time.
Feel free to vote if it's sponge or sucker.
Yeah, we'll put that one out there so I have the right nomenclature there. But we don't want to be like that. And we want you to see your families and we want you to talk to them. But we really, really want you to stay safe too. So we would advise against Easter visitors. Now, it's okay for families to gather in their own home. They've been very clear on that. So, have a family dinner, have an Easter dinner, just don't invite a bunch of people from out of state.
Yes. And one of the questions was, well, what if I've been holed up in my house and this person's been holed up in their house and I mean, is it safe? It's in theory, right? Yes, maybe, but what we don't know is, did somebody come to their house and visit or, and expose them or whatever? So it really is, it's hard to say, yeah, go for it, because we just don't know. And we just, when in doubt, camp out and camp out alone in your own county.
Yeah.
Away from bears. That's also good advice.
Erica says fun suckers.
Oh, we also got a buzz killer. All right. Thanks, David. Point of care testing, Mark. So right now in Kansas, we don't have that availability. Like we said, we have 24 to 48 hours turnaround time. Can the Easter Bunny
take the Easter Bunny's temperature before he visits?
Yes, not a rectal temperature. That would get weird really fast, and we're trying to avoid that. So avoid bunny rectal temperatures. So we aren't doing point of care testing here, but we are hearing that there are businesses that are contracting directly with testing companies, not consulting the doctors, not consulting health departments, but just testing, and then nobody orders the test and nobody gets the results of the test. Yeah. You can see that we're not super,
we're not real excited. Thrilled about that.
These are not super
we've
excited.
We've just found out about that.
Like this week.
Yeah, like this week. So not thrilled.
So we'll go back to one of our statements of, we're all in this together. If we are not communicating and we're not figuring out where to monitor and who has what, and it's not being communicated to the community effectively, then that's where we have problems. Yeah. So that's why we kind of frown upon that.
It's not because we don't want the people to get tested, because that's fine. Yeah. It's just, there's no point in testing them if no one knows.
Yeah, and we need that coordination of care to make sure everybody's on the same page, for sure. What are your thoughts on co-infection? You know, we've been doing a lot of research on this because at first they said, oh, there's no way, like no one's going to have the flu and also coronavirus. That's just craziness. But what we are finding is that there are co-infections that are happening. There are different rates throughout the world, actually, at this point. So we have to keep that in mind. We're trying to, again, be very vigilant. No, what did we say? What did we decide that we're? Oh no, that was vigilant.
It's vigilant. We're trying to be very vigilant about that.
That's our new word: diligent and vigilant. But so if we have a high suspicion for coronavirus, but they also test positive for something else, then we might go ahead and test them just to make sure. So again, it's all kind of, we have to put together all these pieces and figure out, because there's no good handbook at this point to tell us exactly what to do.
Yeah. And thanks for asking, Diane. We're trying.
We're trying to take care of ourselves.
We're trying. We were just looking at the bags under our eyes thinking, oh, this has to get over soon. I just touched my face.
Don't touch your face.
I did it.
I'm not going to touch your face. Has anyone seen the movie Face Off? It's like the worst because like it's gross in general, not even in a pandemic. Like,
yeah.
Anyways, whatever. Okay, let's see what else we have. Okay, that's our sister Candy. She's asking if we want to come over for a weenie roast. Thanks, Candy. Alrighty. What if there's anything else that we can think of? Anything else we might have missed? We want to do our. Oh, does that make us vigilantes? Maybe. Wow.
Could be.
So we want to do our last call. Since we can't be sitting in the bar together, we're going to call last call on these Facebook Live sessions.
So bad.
Oh, don't itch it. Don't do it. One last thing. We are trying our best to stay 6 feet away during these things. Someone brought up that we see pictures, we see healthcare workers that are doing good things, but they might not be 6 feet apart. When we talk about exposure, the CDC is defining it as 6 feet or closer than 6 feet for 10 minutes or more at a time, or direct contact with somebody who has symptoms like they're coughing or sneezing or they sneeze on you, whatever. So I bring this up because we are trying to be very careful. We're all trying to be very careful. When we're in the hospital and we're taking care of patients, we're passing each other right and left, but we're doing it in a very careful way. So we don't want to make it seem like we're not abiding by the rules that we're asking everybody else to abide by. We're taking our job seriously, but we know that we're going to have some of that those paths crossing, and we know how to properly make sure that we're not exposing each other. And again, the reason we have those guidelines, not that there's anything magical about it, but it has to be some sort of definition so that it can't just be like, I just walked by Destiny, so obviously I'm exposed, Yeah. So we're just trying to give some sort of guidelines to be able to determine if there's actual exposure.
Yeah. You're going to walk past people in the grocery store and on the street, and that's okay.
So it looks like we are officially declaring John Boss the winner of this year's Easter egg hunt. Congratulations.
We are?
Yeah, I think that's, he's finally going to win this year. And so, congratulations. That's really exciting.
Yeah, that's good stuff, John.
And if you feel as though, if we're all sitting here thinking, I almost itched my nose.
It's hard.
If we're all sitting here thinking, oh my gosh, teachers are saints, and they're amazing, you should be, because all of us are doing some sort of homeschooling at this point, and we're with our kids way more than we usually are, and teachers are amazing. So thank you for the work that you're doing out there all throughout Kansas and all throughout the country. I don't know how you do it, but it's really, really great. So thank you. Shout out to our school district and the administration and teachers and for keeping our kids alive for this long. Amazing, really.
Shannon asks about wiping your items down with Lysol wipes once you return from the grocery store. Because Lysol wipes are in kind of short supply, I would recommend washing them with soap. Mm-hmm. Obviously, you can't the cardboard boxes and stuff.
And meat, don't wash your meat. We don't encourage soap and water meeting.
No, but Jen has explained before how the soap breaks down the virus and you can wash it right down the sink and so
soap and water is good enough.
Soap and water's good. Yeah.
Yes. Let's see. Okay. All right, you guys, it looks like we are nearing our end. We have officially made, when I say we're nearing our end and somebody puts a little heart there, I hope that means that you
They're
liked
like,
it.
yes,
and not like,
finally.
they're stopped
They're
talking.
about done.
So we're going to be doing this for a while every Tuesday at 5:30. We just kind of set a date, and so hopefully you'll continue to join us. We maybe can talk Shelby into more T-shirts. We'll see what we can do. You hear that, Shelby? We're coming for you, but from a reasonable distance.
Yeah.
So. Also because you're a minor and that seems like assault. We're like, make us T-shirts. So we are going to continue to provide as much information as possible. We know that the cure to some of the fear that's involved with this virus is just education and knowing that we're not alone and that that we are all educated on what's happening. So we're here for you. We'll answer any questions you have, and we'll keep doing it as long as you need us. So as with let's see. Oh, hold on.
If a person sprays a water repellent on the cloth mask, will it work better?
I don't know. The question is, can you spray water repellent on a cloth mask, and will that work better? Thank you, Shani.
Theoretically, one would think so,
but then what's the like? What if you're breathing in chemicals?
Yeah, I'm not sure that's a good idea.
Yeah. So, but thank you. I don't know if you're spraying down my stuff at work, Shani, with chemicals I don't know about. If you are, please let me know. So that one we would say probably not. Maybe reinforcing it with a different type of material that's less porous would be more of a better option. Than
She said she was going to stump us, and she did a pretty good job. She's been thinking about it all day. I'm impressed.
Alrighty. Okay, you guys. Please be safe. Know that everything that we're doing here is to keep everybody safe, and that's not just you listening. It's our families and our families' families and our friends. If you need to be in quarantine, stay in quarantine. 14 days, every bit of 14 days, not 13 days and a half, not 12 days plus a grocery store run. 14 days for a quarantine, pretty please. And everybody is asking you to do that to keep us safe.
I thought of something else.
Oh, yes.
So there's been a bit of confusion about if you are exposed and if you are in isolation. I want to be really clear that isolation is different than quarantine. We don't have anyone in isolation in the county at all because we don't have any positive cases. But those people who are in isolation, who are sick with COVID-19, do not have to be in for 14 days. They have to be in 7 days from when their symptoms start, or 3 days where they don't have a fever, whichever is longer. So at least 7 days. If you're diagnosed, you have to be in isolation at least 7 days. In some other counties, there's been some nastiness where people have gotten well and gotten released from isolation, and people have been very mean to them because it's not been 14 days. So I want to be really, really clear. They don't have to be in there for 14 days if they're sick.
And you might wonder, well, that's shorter than 14 days, someone in quarantine with no symptoms. Well, the point of quarantine is to see if you develop symptoms, and you have that full 14 days to see if we develop them. So that's why there's a difference in that timing there.
Yeah.
And even after you are released, then, you still have to take those precautions, and those might be the people that are wearing masks and whatever. But again, no virus shaming, please. This is,
it's no one's fault if they catch it.
Yes, we're trying to make everybody feel okay with stepping up and saying that, yes, I was exposed, or I need to be in quarantine, or whatever.
We don't want a stigma against COVID-19. We want to know. We don't want people sneaking around with it.
Hate the virus, don't hate the person with the virus.
Yep.
Right? Man, I just feel like we have a lot of T-shirts that are happening. We're gonna do a GoFundMe just to make
get T-shirts.
All right, you guys. Thank you so much again for being here. We'll be back here next Tuesday at 5:30. And if you have questions in the meantime, feel free to message us or comment on our feeds or whatever, and we
call
will
the health
take care of you.
department, email, any way you can get a hold of us, do it.
All right. Bye-bye, everybody. Thank you.
Bye.